Treatment and prevention of emphysema. Emphysema is chronic inflammatory destruction of the walls of the alveoli of the lungs. There are millions of alveoli in both lungs that perform the filtration of the human blood. That is provision of oxygen and to expel the carbon dioxide outside the body of the human. When these alveoli, they are the unit, they are destroyed, their volume is reduced, functional volume is reduced, their volume is just like a rubber which can be stretched and squeezed, shrunken. So this elasticity is decreased or lost according to the degree of the emphysema disease. Mostly emphysema, which is included under the umbrella of COPDs, chronic obstructive pulmonary diseases. It is a group of diseases. So it is a part of this category. Mostly it is associated with chronic bronchitis. This is to remember that these diseases of COPD, they are not curable. That cannot be reversed to normal. But the symptoms can be reduced. The complaint of the patient, the trouble of the patient, the pain of the patient, the agony of the patient can be lessened, reduced, and we can provide comfort to the patient by the various methods, medical or surgical. So there is chronic bronchitis and there is also emphysema. Both these two diseases produces difficult or harden the respiratory system of the person. So there is chest pain, shortness of the breath, breathlessness, cough, wheezing. So these are the major symptoms or the complaint of the patient. We perform X-rays, pulse oximetry. It is a very small device. By fingertips circulation, we can estimate the percentage or saturation of the oxygen in the blood. It should be above 90%. When it is below 90%, it means the function of the alveoli has been reduced to the subnormal level. So we have to perform the supplemental oxygen transfusion to the patient. In addition, we estimate the arterial blood gas percentage. That is the percentage of the oxygen and carbon dioxide in the blood of the patient. Then we also perform the blood examination for the alpha-1 antitrypsin enzyme level, because this enzyme is produced in the liver, and in genetic diseases there is, the mutation of the genes, abnormal genes, the production is reduced, due to which this enzyme is necessary for the health of the alveoli, function of the alveoli. So the inner lining of the alveoli, which is sensitive, meant for the absorption of the oxygen, is destroyed. Now the treatment starts with the longer acting and the short duration or the short acting bronchodilators. Because as I have mentioned, this emphysema is mostly associated with the chronic bronchitis. So we have to dilate the air passage so that the inspiration is increased and the expiration is also facilitated to give relief in the respiration of the patient. So these two groups of the medicine, they are used in combination along with the anti-inflammatory drugs for short duration, especially in emergencies case, that is the steroid, corticosteroid, that can be given along with these two group of dilators. But steroids they are meant for short duration because there are certain side effects of the steroid therapy. That is, for long duration, it produces edema, that is weight gain, hypertension, increase in diabetes, and also it suppresses the normal immune system of the patient. So it is only for short duration to lessen the inflammatory process of the airway as well as the inside the alveolar walls. So this is the mechanism by which we start treatment. Now these medicines can be given orally, systemically, also through the inhalers and the nebulization system. But these are all three groups, that is the short acting, longer acting bronchodilator and the steroid. They are given in combination form. So this is a very suitable method of transfusion, that is for the bronchodilator and the treatment of the emphysema. Now, when the medical therapy is unable to give relief to the patient, though these two medicine or the group of medicine in the COPD, they cannot be reversed. They are irreversible. They cannot be cured altogether, but they can be reduced. Their progression, that is progress of the disease, can be minimized, can be lessened. The speed can be reduced by the medical treatment, and when medical treatment could not provide sufficient relief, then we proceed to the surgical manipulation. That is the lung volume reduction surgery that we perform bunectomy. The disease or the damaged area which produces pressure over the normal functioning, rest of the normal functioning alveolar area, that has to be removed. So the sufficient space is produced so that the normal functioning alveolar grip can be preserved. Now there is another method that is called bronchoscopic implantation of the one-way valve in the bronchi. By this method, we can reduce the entrapped air in the alveoli, which is consisting of carbon dioxide. We can expel that entrapped area outside. So we can produce space for the fresh air which is laden or full of the oxygen. So these are the various methods, surgical procedure, which are performed by the various surgeons when the medical treatment cannot produce sufficient results. Now the prevention. The main factor is tobacco smoking. The smoke of the tobacco produces hundreds of the chemicals that produces irritation, inflammation, damage to the airway as well as the air sacs. So that produces, these chemical produces prolonged chronic inflammatory damage to the respiratory tree or the system. Second is the provision of the atmospheric purity, that is air pollution to be avoided. The residents should be away from the factory area. There should be very clean and neat sanitary system so that the fresh air can be provided to the inhabitants or the residing persons in their locality. Now then comes the pulmonary rehabilitation exercises. The remaining healthy tissue which are not damaged by the disease, they are further potentiated by the various pulmonary exercises which are provided or which are educated by the healthcare provider to the patient to potentiate, aggravate the capacity of the healthy lung mass, which is remaining, that is which is not diseased one. So these are various exercises to produce the vital, to enhance the vital capacity of the remaining healthy alveolar mass or the area. Then now there is psychological complications, neurological complications, that is you have to avoid the stress and depression factors. You have to provide patient a very clean and neat atmosphere and also provide the yoga exercises or the meditation to give him psychological or mind rest or the healthy mind. So person should be free of the stress, thinking, worries, fear. These factors they also influence the somatic diseases of the human body.